nice to meet you. My triage nurse tells me that you've been dealing with a pretty substantial migraine for the last few days, is that right? I see. And this is not an uncommon experience for you, is that right? I'm sorry to hear that you get headaches regularly. Well, tell me a little bit about it. When did it start exactly? What brought it on? Tell me a bit about it, okay? So it's been about 2 days now, and noises tend to trigger it, okay? My nurse did mention that you are experiencing some phonophobia, and so because of that I've been whispering. Is that okay? Alright, I'll keep my voice down for the duration of the assessment today. And so your pain is more in the frontal aspect of your head, okay? And it's throbbing. Alright. Did it come on gradually or all of a sudden? Gradually. Does this feel like one of your typical headaches? It does, okay. If you had to put the pain on a scale from 1 to 10, 10 being the worst pain you've ever had in your life, where would you put this pain? A 7. Oh, I'm sorry to hear that. And you've been having a bit of nausea, I hear, as well. Okay, we'll be able to help with that. Have you noticed any vision changes? Okay, some shimmering in your vision. Alright. Okay. And do you have any allergies to medications? No. Good. Do you have any other medical problems other than headaches? No. Good. And do you take any medications routinely? No. Alright. Okay. Well, I'm glad you came today. We'll be able to help with this. It sounds to me like you're having a pretty typical migraine. We'll be able to give you some things to help with your nausea and with your pain. But in order for me to make sure that you're not dealing with something particularly sinister, I'll need to perform a neurologic assessment on you. Is that okay? Alright. The most important part of this assessment is going to be a cranial nerve exam. Yes, so we'll assess some of the nerves that run through the head to control the head and neck. They affect sensation, hearing, motor skills, a number of things. Is that okay? Good. The rest of the neurologic exam can wait for now. Alright. Well, the rest of the neurologic exam consists of reflexes, cerebellar testing, motor and sensory function for the body. Yeah. Well, we'll start with the cranial nerve exam and take it from there. Okay? Good. I'm just going to administer something here that's going to help quite a bit with your nausea and with your pain. Good. So you let me know if that helps, okay? But we'll go ahead and get started on this. I'm just going to make some quick notes based on our discussion. And you're 28 years old. Okay. 28-year-old female. Okay. Oh, you're a little nervous. No problem. No problem. Well, I'm glad you came today. We'll definitely be able to help you. I'll walk you through the cranial nerve exam as we do it. Alright. Brilliant. Okay. Now, are there any questions before I get started? No? Okay. Then let's go ahead and begin. So, the cranial nerve assessment consists of an examination of 12 different nerves. The first cranial nerve is the olfactory nerve, and this relays information regarding your sense of smell. And so, it's a simple test, but I have some different smells that we can consider together here, and you can tell me what you experience and if you can smell everything okay. Alright? So I've got 3 samples here, and I want you to tell me what exactly you smell. I'm going to begin. Were you able to smell that? Okay, and what did you notice? A banana, that's correct. Absolutely. So the first one is done. Here's the next one. Okay. What did you notice about that one? Coffee, that's right. It was coffee. Very good. And the last one. What did you think of that one? Cherries. That's right. Absolutely. You did well. And so, I think based on that, we can conclude that your first cranial nerve, the olfactory nerve, is intact, and there are no issues there. Very good. The second cranial nerve is the optic nerve. This runs from the back of your eye into your brain to relay information regarding your visual fields, as well as your visual acuity. It also contains some important information regarding your pupillary light reflex. So we'll test that now. Now, you mentioned to me that you had no change in your visual acuity, is that right? Good. And I noticed you're wearing corrective lenses. Good. Because this is a simple test, you can keep your corrective lenses on and we'll do a binocular visual acuity test, okay? Alright, nice and easy. So here I have a Snellen eye chart, and this is a pocket chart, but it will allow us to do a proper visual acuity test. So we're going to hold it approximately 30 or so centimeters back, and I'd like for you to tell me, what are these letters? And this. Good. And this. Good. Good. Very good. Good. Very good. So, I'm just thinking about that to calculate your visual acuity. You are able to see all of the important letters and shapes to bring us down to a very good and appropriate score of 20/20 vision. So what this tells me is that your corrected visual acuity is 20/20. That's an excellent result. I'm very happy with that result. Next, let's assess your visual fields. So in order to do this, I'll ask that you focus straight ahead at me, and I don't want you to look off to the side. What I'm going to do is wiggle my finger and bring it into your visual field, and I'd like for you to tell me when you see the wiggling finger, alright? Pretty straightforward test, but I don't want to see any peeking. Alright, let's do it. Tell me when you see the wiggling finger. Good. Very good. Good. Very good. So your visual fields are intact, which is a very good sign. Now I'd like to have a closer look at your pupils. To me, they appear to be symmetrical and appropriate sized. I'd like to assess your pupillary reflex now. As part of this exam, we'll be testing both cranial nerve 2 and a portion of cranial nerve 3. Cranial nerve 2 carries afferent information regarding the pupillary light reflex, while cranial nerve 3 carries the efferent response. So, shining a light in your eye and first observing the pupillary light response. Okay, excellent. So your pupils are equal and reactive to light bilaterally, which is a very good sign. For the next assessment here, I'm going to do what's called a swinging flashlight test. And this test is looking for what's called a relative afferent pupillary defect. So this test is going to be moving between your two eyes. Okay, excellent. So you do not have a relative afferent pupillary defect, which is a good sign. A normal result will show that as I shine light in your eye, your other eye will show a similar and equal pupillary reflex. If there was a defect there, we would not see that. We might see the other eye become dilated rather than constricted. And so, this is good news. Next, to assess the optic nerve at the point where it reaches the retina, we can perform fundoscopy. I'll defer that test for now because my nurse is currently using the fundoscope, and so we can come back to that test if needed in the future. For that test, I would be observing the optic nerve, including the cup and disc of the optic nerve, to look for something called papilledema, which would be an indication that there is increased intracranial pressure or something sinister going on in the posterior aspect of your eye. Alright, let's carry on. Let's have a look at your extraocular movements. The nerves that innervate the extraocular muscles to control your eye movements are cranial nerves 3, 4, and 6. Cranial nerve 3 is the oculomotor nerve. Cranial nerve 4 is the trochlear nerve, and cranial nerve 6 is the abducens nerve. Cranial nerve 6 innervates the lateral rectus muscle, while cranial nerve 4 innervates the superior oblique muscle. Cranial nerve 3 controls all of the other muscles that are responsible for all of the very nifty movements that your eye can do. For this test, I'd like you to look at this pen. Now I'm going to ask you to follow this pen and let me know if you have any double vision whatsoever. Very good. Are you experiencing any double vision? No? Good. Any double vision at all? No? Good. Now I'm going to assess your accommodation. I'm going to move in towards your eyes and follow it in. Good. Excellent. How do you feel after doing that test? Normal. Good. Excellent. And no double vision. Brilliant. As I mentioned, the oculomotor nerve also carries that efferent information regarding the pupillary light reflex, which we've already tested, so no need to repeat that examination. Brilliant. You did great. So, in doing that test, we've actually assessed 3 cranial nerves. We're going to move on to cranial nerve 5, the trigeminal nerve. Now, this nerve carries some interesting information. First and foremost, it's divided into 3 segments: the ophthalmic, the maxillary, and the mandibular branches. And there's a nerve that goes to each side of the face, so we need to track your face bilaterally on this test. Now, this nerve carries sensory information, so both light touch and sharp pinprick test. That is going to give us an idea regarding your overall sensation to your face and ensure that it is symmetrical bilaterally. Cranial nerve 5 also carries important information regarding the muscles of mastication, and so it will actually innervate those muscles to allow you to chew. This includes several muscles that we'll be looking at, including the masseter, the temporalis, as well as the pterygoid muscles. So we'll run through a couple quick tests for that. The last bit is that this carries information regarding the corneal reflex. Now, we're not going to be assessing that because it would require me to actually make contact with your eyeball with a small cotton wisp, and I'm not going to do that today because it'd be very unpleasant for you. Alright, so let's do the assessment. First, let's assess your muscles of mastication. So I'll get you to bite down. Good. Now continue to clench your teeth. I'm going to feel your temporalis muscle. Good. Excellent. Now I'm going to feel your masseter muscle. Good. Normal. Now I want you to open your mouth. Good. And I'm going to push against the bottom of your jaw. I want you to resist against me. Good. Now we're going to do the other side. Brilliant. So you have good, strong muscles of mastication with no signs of any kind of deficit or issue there, so that's very reassuring. Next, we're going to test your light touch. First with the ophthalmic branch. Does that feel the same on both sides? It does, good. Next, the maxillary branch. Did that feel the same on both sides? Good. Next, the mandibular branch. Did that feel the same on both sides? It did. Excellent. Brilliant. That's a very good finding. Next, we'll assess the sharp touch. I'm going to use a dulled needle blade and just press it against your skin, and you tell me if it feels the same on both sides or if there are any differences. Same on both sides, good. Excellent. Same on both sides, and now. Brilliant. Yes, so that is the same on both sides. That is a very reassuring test. I'm just going to adjust this. Sometimes the equipment needs to be adjusted. Alright, so with that, I'm very happy with cranial nerve number 5. I think it's important that we move now on to cranial nerve number 7. As you know, we've already tested cranial nerve number 6, the Abducens nerve, which innervates the lateral rectus extraocular muscle. And yours is working brilliantly, so nothing to worry about there. For the facial nerve, this controls the muscles of facial expression. It also carries information regarding the anterior two-thirds of the tongue, specifically sensory information. And so we'll have a closer look with that as well. So first and foremost, do you feel anything abnormal with your tongue? Difficulty speaking or talking, or any numbness or tingling? Nothing. Good. Brilliant. And next, I'm looking at your face, and I can see that there are no asymmetries, there are no facial droops, there are no abnormalities here or flattened nasolabial folds. That's a reassuring sign as well. So, the first test I'm going to ask you to do is to wrinkle your forehead. Brilliant. Good. So that was a normal bilateral and symmetrical wrinkling of the forehead. Excellent work. Yes, that's the frontalis muscle. Yeah, absolutely. Next, I'm going to ask you to close your eyes as tight as you can. And I'm going to try to open your eyes, but I want you to resist, okay? Okay, so that's good strength. Yeah, no, absolutely. So good, strong muscles there, that's great. Now I'll get you to close your mouth as tight as you can. Now don't let me open it. I'm going to try to open it. Brilliant, so that's good strength. Next, I'd like you to fill your cheeks with air. Nice and big. Good. Now I'm going to press on them. I want you to not let any of that air escape. Good. So that's good strength. Yes, that's a funny test as well. Yes, it is necessary. It is necessary, absolutely. Now show me your bottom teeth. Good. Good. Excellent. Good work. Okay. That's excellent. Yeah, you've done a great job. So the muscles of facial expression are intact without any abnormalities there. It's very reassuring finding. So that's good news. The next nerve that we're going to assess is the Vestibulocochlear Nerve. This is cranial nerve number 8. Now this nerve carries important information regarding your sense of hearing. And so we're going to see if you can hear what I'm saying while I distract your other ear. And we'll do it on each side. Okay, are you ready? The purple bus knows best. What did I say? The purple bus knows best. That's right. Alright, now we're going to try the other side. Alright. The car drives slowly. What did I say? The car drives slowly. Excellent. Now the next test is called the Rene test, and this is going to assess your conduction hearing. So, as you know, sound information is transmitted into the skull either by two means. One is sensory neural, which means that the airwaves come through and vibrate your tympanic membrane, which then transmits along a series of small bones inside your ear called ossicles, information which is relayed to the nerves in the posterior aspect of your ear. The other way is through bony conduction and vibrations in the environment. I have here a tuning fork, and what I'm going to do is strike the tuning fork to activate the sound, and I'm going to place the base of the tuning fork onto your mastoid bone. It's a small bony prominence behind your ear, and I want you to tell me if the sound becomes louder or quieter when I do that. Alright. If the sound becomes quieter, it sometimes can be an indication of a conductive hearing loss. And if the sound becomes louder, that is a normal finding. Are you ready? Let's do it. And what did you experience? The sound got louder. Good. Good. Okay, let's repeat, and this time on the other side. Good. And what did you experience? The sound got louder again. Good. So that's very reassuring. The next test is called a Weber test, and this test will require me to also use this tuning fork. I'm going to strike the tuning fork to activate it and place it in the center of your forehead. It's important for you to tell me if you feel the sound is louder on either one side of your head. And this is for a sound lateralizing or localizing feature. This will help determine if there is an asymmetry in your ability to hear. Alright, let's do it. What did you experience? It was the same on both sides. Good. That is a normal finding. Excellent. So no problems with your hearing. That's a good sign. Alright. How are you feeling, by the way? Your nausea has improved. Good. Has your pain improved? Good. Alright. Just a few more moments here and we'll be able to provide some further information as well as some further treatment options here to get you feeling more comfortable and get you on your way home. Good. Alright. So, for the next test, we are going to assess two nerves. The first nerve is cranial nerve number 9, which is the Glossopharyngeal nerve, as well as cranial nerve number 10, the vagus nerve. Now, the Glossopharyngeal nerve contains information regarding sensation to the posterior oropharynx, the back of your throat. It also contains information regarding the gag reflex, which we'll not be testing today. I think you've been through enough. The vagus nerve is important for swallowing and managing the soft palate, and so we'll have a look, and then I'll ask you, I see you've got a water bottle there, I'll ask you to swallow some water from your water bottle. Okay, brilliant. So let's get started. First, do you have normal sensation in the back of your throat? Good, everything feels normal. Okay, brilliant. Alright, now, if you don't mind opening up for me and saying, ah. That's it, open nice and wide. Good. Now say, ah. Good. I can see your soft palate elevating appropriately. And now I'll ask you to take a drink, please. Good. Good. And how did that feel? Normal. Good. Alright, I saw good accessory muscle recruitment, and that was a normal test of your swallowing ability, so excellent work. Alright. There are two final cranial nerves that we must test now. The first one is the accessory nerve, cranial nerve 11. This nerve innervates muscles in the head and neck to control neck and shoulder movements. So first and foremost, I'd like you to shrug for me, and I'm going to press down on your shoulders. Alright. And I want you to shrug against my resistance. Good. How does that feel? Good. I'm sensing good strength here. Next, we're going to assess your sternocleidomastoid muscles. Now, these muscles run along the side of the neck to assist with turning your head. Alright? So, keeping your head at the midline, I'm going to push against your chin, and I want you to attempt to turn your head against resistance. Alright, ready? Good. Very good strength. Now the other side. Very good strength. Excellent work. Fantastic. So, you have good innervation with cranial nerve 11, and there are no concerns from my perspective there. The final nerve is the hypoglossal nerve, and this controls muscle in the tongue. So what I'll ask you to do, first and foremost, is stick out your tongue. That's right. Good. And so, I can see here that your tongue is midline. I don't see any signs of muscle wasting. Everything looks normal. Now I'll get you to stick your tongue inside your mouth and push against your inner cheek. Good. I'm going to push against you. Good strength. And on this side. Good strength. Excellent. So, in review here, I see that you've got very excellent function of your cranial nerves, 1 through 12. Everything appears very normal. Now, what I'll do is I'll ask our nurse to come by and get a liter of IV fluids going here to try to rehydrate you, get you feeling better. We'll give you another dose of the antiemetic that you were taking to try to deal with the nausea that you're feeling. And I suspect you'll feel a whole lot better. Then I want you to take a nice long nap when you get home, and then just rest for the next 24 hours. Alright, brilliant. Do you have any questions for me? No? Good. Alright. Well, it's been very nice meeting you. I hope you feel better, and I'm very reassured by your exam today. Nothing to worry about. Alright, take care.